So in this recording, we are going to discuss what happens when heart fails. And we will discuss separately left and right heart failure. So first, I would like to raise the question, what does it mean that heart fails? It means that it's not able to produce sufficient cardiac output for the body needs, right? So cardiac output is the key parameter that characterizes the heart. And when the heart fails, the cardiac output is decreased and the activities of the person that has a heart failure, those activities are reduced. So, for example, it may become difficult to even do common daily tasks like carrying groceries or cooking a meal, right? So that's one thing. So the cardiac output is decreased. But then in um, uh, the heart that is not able to pump the blood forward from the ventricle into aorta, the blood that is coming from the body will be stagnating in the pulmonary veins. Right? Pulmonary veins lead just to left atrium. So if the blood is not moved forward by ventricle, so the blood stays in atrium and then pulmonary veins, and it's difficult um, to move it ahead. So now the important aspect of that is that the blood here would be the direction of pulmonary vein. So if the blood is stagnating here, then the hydrostatic pressure at the venous end of pulmonary capillaries is increasing. And if you already went through the recording on the Starling law on capillaries, you know that this drop in hydrostatic pressure as the filtration occurs at the arterial end, that the drop will not be favorable for absorbing the fluid that was filtered at the arterios end of the capillary. So what happens is that here fluid is filtered, and here at this end it's not possible to reabsorb it because that force of hydrostatic pressure here is higher, and it will prevent the filtration. What's going to happen is the fluid will accumulate in the lung tissue, which we call lung edema or pulmonary edema. The pulmonary edema, then you see here a picture of an alveolus surrounded by pulmonary capillaries. And when there is pulmonary edema, the fluid accumulated in the tissue may even get into the alveoli. And now oxygen that travels with air into alveoli has to travel significantly longer distance through the fluids before it reaches red blood cells. As a result, in the pulmonary capillaries will be, or pulmonary arteries, the pulmonary circulation will suffer hypoxemia, which means a reduced amount of oxygen. And in pulmonary circulation, there is this physiological mechanism that when there is a lesser amount of oxygen in certain area, that area is vasoconstricted to reduce the blood flow through area that is not properly ventilated. So this is a physiological mechanism that is assuring that the areas that are well ventilated get a significant amount of blood flow, but the areas that are not properly ventilated, from those areas, the blood flow is redirected to better ventilated areas. But now in this pathological situation, where the hypoxemia leads to hypoxic pulmonary vasoconstriction, it will not be as effective because large part of the lung undergoes edema, and instead the increased resistance of those vasoconstricted pulmonary arteries will make it more difficult for the right heart to pump into pump the blood into the pulmonary circulation. So as a result, the left heart failure that not only leads to decreased cardiac output, but also to congestion and of blood in pulmonary circulation, increases the resistance of the pulmonary vessels and may cause the right heart failure. In fact, the most common cause of right heart failure is the left heart failure. So how does it present? You had the picture here. So the person is sitting, right? He's trying to gasp some air from the top of the lungs, while a big part of the lungs, the lower part of the lungs, are filled with edema. So there is much more difficult for the oxygen to travel to the pulmonary capillaries. And it's typical that when people lie down and the pulmonary edema occupies the whole lungs, they wake up in the middle of night and prefers sitting position in order to get some air through this place. So this is called orthopnea. They feel tired because they don't have enough blood going. They are poorly oxygenated. Their heart is trying to compensate through baroreceptor reflex, through tachycardia, increasing the heart rate. They have, when physicians or nurses listen to them, you can hear crackles. The person may cough. You will hear wheezes, and that's all because the lung tissue is now swollen and creates these signs. So two problems with left-sided failure: low cardiac output into systemic circulation and pulmonary edema. Now, with the right heart failure, we have to imagine the anatomy. Now, if the right heart is not able to pump the blood into the pulmonary artery, the blood is accumulated in the right atrium and in the big veins. And so the symptoms will affect mainly the systemic veins. And again, there will be Starling law, and capillary will be affected, but now in systemic capillaries. And the person is going to have increased jugular vein because the blood is not properly moving to the right atrium from the upper body. And they will also have a swollen abdominal cavity. So this is called ascites, where there is a fluid in the cavity and abdominal cavity. And then there will be also swollen legs. So you see that the symptoms are a little different because they are coming now from systemic veins. So once again, heart failure means lower cardiac output, both on the left and right side. The left side failure is going to lead to accumulation of blood in lungs, so pulmonary edema, while right heart failure is going to lead to accumulation of fluid in systemic veins and therefore jugular vein distension, ascites, and swollen legs. Right now, one more thing that I wrote here is that the cardiac output on the right heart, when it's decreased, because the heart is not able to pump against higher resistance, it means that also it less blood is going to arrive through pulmonary circulation into the left heart. And that means that according to Starling law on the heart, that the cardiac output of left heart will be decreased because of the right heart failure, right? So here we conclude the heart failure, at least in broad strokes, right? All the best.